Now to this. The focus in California has been on redistricting, with voters passing Prop 50 last night, but what's being overlooked is the state's budget for the new year. California plans to spend, get this, 28 times more on health care for illegals than on law enforcement. According to the new budget, state police will be allocated just over $348 million. That pales in comparison to what the state plans to spend on health care for illegals. According to a report from the state's Legislative Analyst's Office, undocumented persons eligibility expansions are estimated to be $10 billion general fund annually, more than double the initial estimates. Joining me now, Chief Patient Officer at the Wellness Company and host of Ask Dr. Drew, Dr. Drew Pinsky. Everybody says we're not spending healthcare money on illegal immigrants. Quite obviously, we are, more than on cops.
Yeah, of course. I mean, how else? Look, there's this weird sense in this country that people go without health care. Nobody goes without health care in this country. And when people get health care, somebody pays for it. I love the Mondani episode here where it's, we need your money so we can give you things for free.
Yes.
That's the way Californians work. This is all so familiar to anybody that lives in California. It just is, this is just more rote socialism that we're stuck with in California.
And yet there was
Enjoy
Gavin
it
Newsom.
here. It's great.
And then there was Gavin Newsom last night, preening, proud,
on the stage, claiming
victory.
Do you see the data? 90% of Californians want to have a nonpartisan committee to evaluate the voter districts, which is what we had and exactly what they voted to undo.
So how do you explain that?
I think people are being hoodwinked by social media and the money that is spent to persuade them, and they're hoodwinked by what they're seeing in the actual voter documents. What are these things I'm voting for?
Yes.
The California voting, the descriptions in the voting material, is just complete lies.
So 90% of Californians wanted what they voted last night to do away with.
Correct. That is a well-documented fact.
It's incredible.
And it's why every time this comes up in California, there's something going on with the voters where I've lost complete faith and trust in them, because every time they say they want one thing, they vote against it.
Do they want to extend Medicaid benefits to illegal immigrants in California?
Do they want to? They're very compassionate in California. We don't. I've been through this before. I worked in county hospitals in the 80s, and then we were dealing with a civil war, multiple civil wars in Central America, and they all came up, and we cared for a lot of the El Salvadorians, the Nicaraguans, and guess what? The state was not involved in that care. The counties had to pick it up, and the county actually went bankrupt doing that. So we have been through these cycles before. Somebody pays for it,
yes.
And eventually it's ultimately the taxpayer.
You can't have an open border and a welfare state. It was famously said by Milton Friedman, and California is testing that exact proposition. We've had 4 to 5 years of open borders, and we've had a welfare state that extends to illegal immigrants that threatens to bankrupt the state.
And the state is not an efficient allocator of capital. And look, we spent $90 billion on a railroad that we didn't lay down a single track. That is the perfect example of how things are done in California. Or the fact that everybody burned down except for the one shopping center that had a private fire department. That was private versus public.
Right,
That's exactly how it works.
One quick question for you, Doctor, on the way out. I have, throughout my life, been opposed to, for example, smoking bans in bars.
Oh, yeah.
I thought that should have been up to the proprietor, to the business owner. I have been opposed to Mayor Mike Bloomberg limiting soft drinks to a certain size. I don't need the nanny state. So what do we think about the Maldives?
Yeah.
Banning smoking for everyone born after 2006.
Yeah. Look, let me be super clear. I'm not saying smoking is good or smoking shouldn't be discouraged. Most countries, for instance, do not have vaccine mandates. 3 of 5 communist countries do not have vaccine mandates. And yes, yet they do a good job of getting vaccine uptake. The same thing is true in this kind of thing. The problem we have here, what I see in this, is that public health policy is out of control. It's become totalitarian. It's intruding upon our bodily integrity and our freedoms, and it's happening in multiple countries, and it certainly is happening here. We have to do something.
Make good choices. Don't have others force you into good choices.
And
Make
let's
good
work
choices.
hard on that, but let's not be a nanny state, as you said, not take over things.
All right. Thank you, Dr. Drew.
Goodbye.
Hey, it's Will Cain. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Cain podcast for full episodes right now.